guys, and welcome back to Project Brainstorm. Today I thought we'll talk about a topic that is often asked in various examinations in medicine, which is emergency contraception. Nice little bite-sized topic, easy points in a variety of examinations. So let's talk about this. Broadly speaking, emergency contraception is when someone has had unprotected intercourse and they need to use a method in order to prevent pregnancy. So the point in question is that they are not pregnant as yet and you're trying to prevent it. Therefore, their pregnancy test at the time of taking these medications would be negative. All right, now let's start. There are, broadly speaking, 3 types of emergency contraceptives available, at least in the Australian context. First is levonorgestrel, which is a type of progesterone. Then you have ulipristal acetate, and you have the copper IUCD, which is the intrauterine contraceptive device also used for contraception. Now let's talk about the main points about them. So first of all, you need to know the dosage of it. So in terms of the levonorgestrel, that is 1.5 milligram stat dose, right? Ulipristal acetate is a 30 milligram stat dose. And copper IUD is an IUCD that's inserted. So it has just got copper coiled across, so there's no real dosage to it. It's one device. All right. Now we need to talk when do we use these methods. So these two are oral methods. This one is an intrauterine device insertion. This method works best when taken within 3 days of the unprotected intercourse. These two within 5 days. Ulipristal acetate in general. This is the most effective oral method, and IUCD, the copper, is the most effective method. So this is a very common MCQ point, and therefore this is like the least effective if you're asked to choose. Then we need to know how they work, so the mechanism of action. So in terms of these two, they are both sort of hormonal in nature, whereas this one is not. So obviously these will have hormonal effects, and most contraceptives work by blocking ovulation. So that's how this works, preventing ovulation, right? And that's for these two methods. Whereas this one, it's copper, therefore there's no ovulation blocking here. It's mostly a local effect because it's sitting inside the uterine cavity right there, and copper is toxic to sperm, and it is also causing a physical barrier, so nothing actually gets implanted or it gets fertilized. So it is mostly physical. Now let's talk about contraindications. So any oral method or any method full stop, if someone is allergic or hypersensitive to it, you cannot use it. So that's common for all of them, allergy. As I said earlier on, you use these when someone is not actually pregnant. So known pregnancy would be also a contraindication to usage for all 3 methods. And then the oral methods, they will undergo first pass through the liver. Therefore, if they have any liver disease, or if they are already on a liver enzyme inducing medication, those will be contraindications for the oral method. Right? Moving on, let's talk about how do we maintain ongoing contraception, because that's also another topic, right? Like after you have given this, if you've taken it, fine, you need to then have some sort of ongoing contraception. The main difference is that ulipristal is not something that mixes well with a pill, so it hinders the absorption of the normal combined oral contraceptive pill. Therefore, for the ulipristal acetate, you need at least a 5-day gap before you can commence the oral contraceptives, whereas with levonorgestrel acetate, it is progesterone, you can commence the pill straight after as a quick start method. And then in terms of the copper, it provides ongoing contraception. That's one of the benefits of it. And it's 5 to 10 years depending on which kind of copper device has been chosen for insertion. Sometimes the women are breastfeeding at the time of this happening. So in that case, can they breastfeed, can they not? Again, ulipristal is at disadvantage here, that they'll have to pump and dump for 7 days. whereas with levonorgestrel and copper, there is no effect to that whatsoever. In Australia, levonorgestrel and ulipristal, both the oral methods are over the counter, whereas copper needs a prescription, and it also needs someone who can do the method for you. So that is everything I can tell you about emergency contraception. Let me give you a little headshot of these notes, and that will be the end of the topic. Hope you like it. Feel free to leave any questions down below. See ya!